Ronald Lawachi is currently at home in a vegetative state where he is being cared for by his wife Anita and the nurse employed by the family. The newsroom visited the family and spoke with his wife, but she did not want her face on camera.
And for the past 8 weeks, we've been suffering. My husband has been suffering because it's mentally, emotionally, physically, and financially. It's been hard for us. And why I'm doing this is because I don't want anybody else to go through this.
Lawachi visited the Diamond Hospital on June 7th as he suffers from chronic obstructive pulmonary disease. On June 8th, the man's daughter visited the hospital where she was told that her father went to urinate and then complained of being unable to breathe. He suffered a seizure. Lawachi was resuscitated by the doctor on duty but subsequently slipped into a coma and was transferred to the Georgetown Public Hospital where he suffered from additional seizures.
All day that day, Monday, he had seizure. He was at the hospital, and one of the doctors keep asking what medication he was using. He wasn't on any medication. So I don't know. Diamond Hospital was supposed to send a chart or something what they gave him, but they didn't. That's why the doctor keep asking.
Anita said if the health workers had transported her husband with his chart, it would have allowed the doctors at the GPHC to treat him in a timelier manner. After 8 weeks in the hospital, the father of 5 was discharged and sent home last Wednesday, but he now suffers from bed sores and other skin conditions which he developed while at the GPHC. The man's wife is also accusing the nurses at the GPHC of carelessness since they did not care for him properly, nor did they inform the family that they needed assistance.
Animals, you won't do that to them. And he's human. He has a family. If you know in the hospital, in the ward, that you can't take care of all these patients. I understand that maybe they're too much and the nurses a little bit, but let the family know. Let us know what we can do for him. Advise us what to do before we reach that stage. Now he's suffering and we're suffering too behind him.
An MRI scan showed that Mr. Lawachi suffered brain damage. Anita believes that her husband's condition resulted from a 45 minutes resuscitation process undertaken by doctors at the Diamond Hospital before he was transferred to GPHC.
But what we understand is that if you give a patient CPR for 45 minutes, you get the organs working. But then the person would be a vegetable, right? So, and doctors know that. So he was not supposed to do that.
However, the newsroom understands that brain damage may have been caused by seizure. A doctor explained that resuscitation process can only result in bruises but cannot cause a brain damage. Bibi Katun, Newsroom.